Hi, I'm your host, Marsha Florence for Just Dance Podcast Live. Well, good afternoon, ladies and gentlemen, for your every other Thursday special on Podcast Live Facebook. So today we have with us a gentleman who is going to give you some insights about your healthcare insurance. So I want you all to think about, we've been home for almost a year or have been home for a year, and some of you have not been to the doctor, have not utilized your health insurance, or may not know how to utilize your health insurance during this pandemic or any other time. So we want to see if we could take some of the fear and the misconceptions out about using your insurance, especially if those of you who have Medicare. So our guest today is Mishael Raiford, independent agent of development design. Good afternoon, Mishael.
Good afternoon, Marsha. How are you today?
I'm good. Thank you for joining us.
It's great to be here. I don't know where I'd rather be. I'm stuck inside, but I get a chance to look across the screen and get great information and see a smiling face. So I'm glad to be here.
Okay. Well, Mishael, can you give us a little bit of insight about yourself and tell us about development design?
Sure, love to. So Development Designs is a project that I launched actually 21 years ago with a focus of helping people understand and navigate the healthcare system. Um, in cities like ours and around the nation, folks have two major problems with their healthcare: access and availability. How do I find a doctor to help me with my particular issue? And then how do I get to him or her on a consistent basis? And so we launched Development Designs to work with small organizations 21 years ago. That kind of naturally flowed into the work I was doing at the time with HAP, Health Alliance Plan, and then into my own independent insurance agency, where I primarily work with seniors, because that's just always been my passion, helping our senior citizens understand and get the most out of their health care. But we work with everyone, families, small groups, individuals, and especially during the pandemic, people have had a hard time accessing, even if they've had insurance, many people have had a hard time just figuring out how to use it. Uh, Telemedicine kind of blew up during the pandemic. Many people didn't know how to access their telehealth benefits through their particular plan. Some plans had very, very good, very effective telehealth plans. Some were not so good. Kind of like learning this whole Zoom thing. Some people are real good at it. Some others are not. And
So let me
so,
ask you this, Mitchell. On the telehealth, and a lot of people, especially some of our seniors, may not be familiar. Can you describe or tell us a little bit in detail what is telehealth?
okay, telehealth is just like television, two-way television, if you will. It's an opportunity for a provider, whether it's a doctor or a therapist, a counselor, to see you, their patient, and you see them, and then have a conversation. Um, a lot of our seniors, Marsha, you're right, are challenged, just that many of our seniors just are not tech savvy. Some of our seniors don't have internet availability. And so one of the things that I try to help seniors understand is ask your plan, whatever plan it is, and I won't call any, but whether it's the blue plan or the orange plan or the green, whatever plan you have, ask them to help you access their telehealth. And so it's a way that you can set an appointment with your provider. They show up on the screen just like we're showing up on the screen right now. Um, but they get to communicate with you, you get to communicate with them. So obviously they can't touch you, but they can see you, and they can do a big part of any exam is a physical health assessment. If you think about the last time you went to your doctor in person, how much time did they actually spend touching you? Probably not a lot. They spent a lot of time talking to you, asking questions, getting feedback. Well, that part can be done through a telehealth um, situation.
Well, I'm
So
sure
there's
that's
no,
part. I mean to stop you, but I'm sure that's comforting to those who are like you said, tech savvy, but those who are not, they still prefer to go into the office and see their physicians, regardless if they actually have, physical contact or not. Then also, a lot of people who deal with telehealth, they may not know it, but the billing is the same. The billing is the same,
Wow.
even if you went into the doctor's office or not. So that's another thing, that
Yes.
the billing doesn't change just because it's over the wave of the telephone or the computer. But let
Right.
me get you this. So,
Let me interject one thing, Marcia, because you brought up something that I forgot. Not only is the billing the same during the course of the pandemic, in some cases the billing is less because some telehealth visits are um, zero office visits. So if you were paying $25 or $30 for an office visit,
mhm.
trust me, the doctors don't want you coming in to see them any more than you really want to go in to see them during the pandemic. So
Oh,
one of the added benefits during the pandemic is many plans offer their televisits at zero copay, zero office visit. So in some cases, it's even cheaper.
okay. So can you give us some insight on what is Medicare? I know you said you work with the senior population, so a lot of our clients or viewers may be on Medicare. Can you give us some insight about that?
Sure. So, and you would think that everyone would know what Medicare is, but we get it confused. Medicare, Medicaid, which one do I have? What is it? Can I use it up? Is it a credit? And so Medicare is a federal health program, started in 1965, right? And over the last almost 60 years, Medicare has changed. Every year changes a little bit, but it's a federal health program for those that are 65 years old or under 65 with a qualifying disability. And so we have 20-year-olds because of their disability, may have Medicare. So you don't, it's not just old people's insurance. It's
Mm-hmm.
people can qualify in different ways. So 65 or older, um, and then having 40 quarters, and this is going to get kind of weird, 40 quarters of FICA insurance. So I love to tell this story. My son got his first job several years ago. He looks at his check and he wants to know, well, what are all these deductions? And who is FICA? And why are they taking money out of my check? Well, FICA pays, well, a portion of FICA pays for Social Security, and a portion pays for Medicare Part A. Four parts of Medicare, Part A, B, C, and D. And your FICA payments, your FICA taxes that come out of your check, um, pays for a portion of Medicare. And you need 40 quarters of working and paying FICA taxes. 40 quarters is 10 years. 40 quarters of FICA taxes pays for your Medicare Part A. So most people, when they turn 65 or because of their disability, when they get their Medicare, they don't have to pay for Medicare Part A, the premium. It's paid for out of your FICA taxes if you
So,
work.
we do know that there's, is it four different levels of Medicare Part A, Part B? Can you tell us about what
Indeed.
each
Yep.
one is?
So think of Part A as your hospital insurance. It pays for when you go into the hospital, your room and board, that bed. Um, it pays for surgeon's fees, for laboratory fees. That $600 aspirin they're going to give you. All that stuff is paid for with Part A. Part B, as in boy, think B as in boy, is your medical insurance. That kicks in when you're out of the hospital. So office visits to your doctor, lab tests. When you go to your doctor, they take blood and they want to send that to the lab. Durable medical equipment. You go to the doctor, you hurt your ankle, you go to the doctor prescribes a brace for your ankle or your knee. You go to the pharmacy and go to CVS and pay for that. That's paid for by Medicare Part B, as in boy. C, think of C as in cat. C are Medicare Advantage plans. And the Advantage plans come alongside your Medicare to pay for what Medicare doesn't pay for. Remember that Medicare, parts A and B, A for in the hospital, B for out of the hospital, but it only pays for 80%. right? So if you go into the hospital to have your gallbladder taken out, and there's a $60,000 bill, the surgeon's fee, the anesthesiology fee, 2 days in a hospital bed, that terrible food they're going to give you, all of that. Let's say
I know
that comes to
the hospital really enjoys enjoys
they
hearing that. But let
enjoy.
me ask you this: so we've had A for the hospitalization, we have B for your medication and prescription covered, and you said there's
Prescriptions come out of Part D.
okay. So D, okay,
D.
so it's
B
so
is
it's
medical, out of the hospital.
okay, so it's actually A, B,
C
C,
and D.
and D.
D.
Okay, and then so then how does a person know when they have all four components?
Okay. And so Social Security, Medicare is administered through Health and Human Services. Go to your Social Security office, and and they will tell you. It'll be on your red, white, and blue card.
Okay.
Everybody, we call it the red, white, and blue card. Down in the lower right-hand corner, there will be Part A and Part B, if you have it.
Mm-hmm.
Part C, you have to enroll in on your own. That's why you see all these commercials on television. You see football players are saying, "Call me about a Medicare Advantage plan," or Tom Selleck is saying, "Call me about it." Right? So they're trying to sell you or convince you to enroll in a Part C Medicare Advantage plan to come alongside your Part A and B.
But is C I shouldn't say is C worth getting it, but the average person may not know to really apply for C. So is there a certain time frame in the year that a person should apply for C?
Absolutely, there is. So there's what's called the initial coverage election period. That's when you first get Medicare at age 65. And the initial coverage election period is 3 months prior to and 3 months after the month of your 65th birthday. Right?
Okay, but if
That's
you're a person with a disability, it's before that,
the
correct?
person with a disability. It's when your Medicare, the month that your Medicare kicks in because of your disability, you are then eligible to select a Medicare Advantage plan to go alongside with it if you want to. And you should. You absolutely should, because remember, Medicare is only going to pay 80%. And so if there's a plan out there that can pay for the other 20% or help to pay for the other 20%, why would you not want to have that?
Okay. So a lot of times, Mitchell, a lot of people don't know that they can actually speak to a person like yourself to get more knowledge on what coverage they have or what coverage they need. So is that as a independent agent, is that what you do? Provide the layout of the different types of coverage a person is eligible for or could be eligible for?
Yep, exactly right. And so we have a short conversation. Someone can call me. And one of the protections, I'm glad you asked it that way. One of the protections that Medicare puts in place is that I may not get a list and call people and say, "Hey, can I talk to you about Medicare?" That's illegal. I can't walk up and down the street and hang and put a note on people's doors. I can't go into a senior building. Basically, as a Medicare agent may not reach out to a Medicare beneficiary unless they are invited to do so. So
Okay.
let's say if you were a Medicare beneficiary, you can call me. I can send you a letter. I'm not even allowed to send you an email, but you have to say to me, "Mitchell, I need more information." That's why when you see the commercials that say, "If you want more information, call this number," right?
Mm-hmm.
They're asking you to call them.
Okay.
Now, beware. One thing, and those are not bad plans. I'm not talking down about any of those plans that you see on television. But let me do say this because I'm a senior advocate. When they say, "If you want more information, call this number." Well, once you call that number, you have now given them permission to call you back, because what they are able to say is, "I did not solicit that person. I did not initiate the conversation. They called us." And once you call them, they can put you on a list and they now legally can call you back
Okay.
because you initiated the conversation. So once you do that, then we'll have a half an hour conversation. about who your doctors are, um, if you like those doctors and want to stay with them. That's one of the key questions you want to ask of any plan that you enroll in. Is my doctor in your network? Because you may not want to leave him or her. Maybe you have a doctor that you don't really care about, or maybe you don't see the doctor very often, and so you don't care who you get your care from. And it's okay, but it should be your choice. So the
Okay.
questions you want to ask anyone that you're talking to is my doctor in your network? Is my
Hmm.
pharmacy in your network? Um, are the drugs or the medications that I'm taking right now, are they on your formulary? Formulary is just a big word for medical list. Are the
Okay.
drugs that I'm taking on your list? Will you cover them and pay for them?
Okay.
Are they a tier one drug or a tier two drug or a tier three drug or a tier four drug or a tier six drug?
Now, does tier mean if it tells the level of strength or something like generic brand or name brand? So what's the tier for?
Yep. It does tell, and I don't want to equate strength because some people think if it's a generic, it's not as strong as a brand, and that may not be so. But you're right. A tier one drug on most formularies is what's called will be called a preferred generic.
Okay, so let's go back to the plain simple English for our viewers. They're not going to know tier one, tier two, but they can ask, is this covered under generic brand or name brand? Can they say that?
They can ask that,
Okay.
but they do want to, and while they may not understand it, and again, that's what a good agent, independent agent. There are lots of us. I'd like to say I'm the only great agent, honest agent out there. I'm not. There are a lot of really good agents who have their clients' best interests at heart. But that's when you ask your agent or the customer service department of the plan that you're using. You do want to know, is it a tier one or tier two? Because most tier one drugs are, um, let me say it this way, many tier one drugs have zero copay, or they are the cheaper of the drugs. And what you want to know is how much is this going to cost me out of my pocket? When I go up to that pharmacy window, how much do I have to pay for it?
That's the truth. That's the ideal question for the viewers. They
And
may
that's why
not
you
be
want to know if it's a tier one is going to be
right.
cheaper than a tier two.
Right. But then, let's be honest, our viewers, not to say someone won't know that, but that would be the least question they would ask is tiers. So they may ask some people will definitely say, is this a generic brand or is this the name brand? What did my doctor authorize me for? A
Mm-hmm.
name brand or a generic brand? So some people do know that term
Yeah.
better than we're going to say tiers. So, now, Mitchell, we have on the table the discussion about Medicare, but what's the difference between Medicare and Medicaid?
Okay. Great question. As I said, Medicare is a federally run system. Medicaid also is, but it is administered by the individual states. So Medicare in Michigan may have different rules than Medicare in Ohio or Indiana or Illinois. So Medicaid, I'm sorry, is a state-run health insurance primarily for low income, and it was designed for low income mothers with children. But so it's an income based, income driven state insurance, and so you have to be at a certain level of what's called FPL, the federal poverty level, um, in order to qualify for Medicaid.
Okay,
And
but
so
Medicaid actually takes care of a family,
it
a family.
can.
Okay,
Well, Medicare will take care of individuals, and if there are families inside an individual, then each individual in that family usually will have their own Medicaid. So if a mom with two children, she'll have Medicaid, and her kids will have Medicaid because she is, but they'll have a record all their own.
correct.
There will be one case manager, but they will recognize three different entities within that household that may or may not have Medicaid because
Okay,
of their
all
their
right. So we
income.
do know that Medicaid is definitely the family plan for low income.
Low
Okay.
income,
And we do know that
aged,
Medicare.
blind, and disabled. Yeah.
Okay, and we do know that Medicare is the coverage mainly for 65 and older individuals and with or without disabilities?
Wow, that's a great question. So let me go back up. For 11 years, I worked for, I can say them, we still like them, HAP, Health Alliance Plan. Great company, local, small, what's called a small regional plan. And for the 11 years that I worked for them, all I could tell you, Marcia, was Marcia, HAP has a great plan. It has a 4 or 5-star rating by the government. Here are the benefits. It's the best plan. And if you ask me, well, Mister, what about the blue people? We won't even call them by name. Well, we can. The blue. What about Blue Cross? I would say Blue Cross has some very good plans too. But I work for HAP. I really can't tell you much information about Blues. I don't know them. I work for HAP. Well, as an independent agent, um, I represent as many companies as I would like to. I'm not that bright, so I don't try and represent a whole lot of companies. I represent 5 companies. HAP is one of them. They're a great company. Blue Cross, everyone knows Blue Cross. Humana, they're also a national company. WellCare, and Aetna. And so if someone has a preference for one of them, if I walk into a building or get invited to speak to someone, when I was working for HAP, all I could talk about was HAP because I worked for HAP. Right? Didn't want to get fired. Now that I'm an independent agent, I can talk about any of the organizations that I am aligned with.
Does an independent agent give the consumer, which is a client, the options to know the difference between all the ones that you represent, to help them decide if they want to sign up with one of those services?
They absolutely do. And so the question that I asked when I said, when someone calls me and says, I need information about an Advantage plan, that 30-minute conversation, when I'm asking them, what medications are you on? How's your dental health? What's most important to you? Well, if I find a client that has a lot of dental problems and they need some extractions, they need some caps, if they indicate to me that they have a lot of dental issues, then I may point them toward one of the companies that has a better, I won't say which one now, but one of those 5 companies has a better dental plan. So I would steer them toward that plan because dental is their big issue. Especially because with a Medicare Advantage plan, every October you see all those commercials on television about if you want to change, if you're not happy. So if you, and I never encourage people to jump plans, but if you get into a plan this year because you have a specific need, well, next October when open enrollment comes around, if that need is not your primary need, and if there's another plan out there that meets your need better, then you have the option to change plans then.
Well, that's a good thing to know that, sometimes people pick a plan and it's not to their advantage. Some of the things are not what they need. And they say, wow, I picked a bad plan. I wish I can get another one. Can they contact a person like yourself, an independent agent, and find out when they could change to another plan? Because, like you just said, open enrollment may be October, but maybe they, don't want to wait till October. Can they actually find out there's a other time during the year or season? That way they can mark their calendar, be ready for the actual change?
Great question. Wow. You must be in the business because you're asking all the right questions.
I'm in the people business. Okay.
So open enrollment just closed. It runs October 15th through December 7th. You saw all those commercials from all those different plans, or we got mail from many different plans. And so if you enrolled in a plan during open enrollment, let's say you picked the blue plan, it started January 1. Let's say you went into your doctor or you had some services January 1 with that plan that you picked during AEP, the annual election period. And for some reason you decide in January that you don't like it. CMS introduced what's called OEP, the open enrollment period that runs from January 1 to March 31 every year. And it's specifically for people like that you just asked that enrolled in a plan during AEP. They picked a plan during that October 15 to December 7 period. And in January or February or March, decided, I don't like this plan. They have one opportunity to change. They can change to another Medicare Advantage plan, or they can drop that Medicare Advantage plan and go back to just original Medicare,
Okay.
Medicare A and B, and then pick up a prescription drug plan. So
Well,
they do have that one time. That's a very important time. Open enrollment, again, it runs from January 1 through March 31, and you have one opportunity to make a change from the plan that you selected
and
during
that,
the.
not to cut you off, but that's one of the most important questions a person would be concerned with. When can I change? If I can change, because anyone who picks something and say, wow, I know this is not working for me, they never know how to go back and ask the question, can I come out of this plan?
No.
They feel that they're stuck with the plan and it's a whole year. And that whole year means that they didn't go to the dentist, they didn't go to the doctor because they didn't like the plan that they chose.
Right. So let me clear that and again, emphasize they have that 3-month period, January 1 to March 31, if, excuse me, they selected a plan during AEP. Otherwise, outside of March 31st, they can change if some significant thing that they qualify for what's called an SEP, a special enrollment period, if certain things happen. If they move, let's say they select a plan and that plan has a service area in Wayne, Oakland, and Macomb County. That's where their service is. Let's say they move to Ann Arbor. Well, that's Washtenaw County. Well, they then can change a plan because they moved out of their plan service area. Um, so there are certain instances throughout the year when you can change.
Okay.
I hope it never happens, but you can also change if the agent that enrolled you in the plan gave you information that was not correct.
Good.
You can then complain. You can call CMS and say, my agent told me I would never have anything to pay.
Okay.
I'd never have anything come out of my pocket. And
Well, you know what, Mishael, our time is running out. I want to ask you to please come back and join us again. And I'm sure we're going to have some calls or some more questions about insurance, especially dealing with the period we're in now with COVID. So by all means, will you come back and join us again?
Would love to come back anytime. I'm not selling a product. I'm helping our seniors. So I'd love to come back as long as I can give information.
Okay. We thank you. We thank you. Well, ladies and gentlemen, as usual, you know who I am. I'm your host, Marsha Florence with Just Ask. If you have a question for Mishael Raiford or any of our guests, give us a call at 1-800-323-5336, 1-800-323-5336, or email me at marsha@justasktalkshow. So I thank Mishael Raiford and our prior guests that always come, previous guests that came to see us. We look forward to you tuning in every other Thursday to Just Ask Podcast Live. I'm your host, Marsha Florence, and what do I always say? If you know a person with a disability or if you just have a general question, don't be afraid to ask, just ask. I'm your host. See you next time.